Hi, how are you?
I'm good, Asha.
How are you holding up?
It's quite tasking, but we thank God that we are moving on well. Though it's something that we've never gone through, and it's quite overwhelming. But I can say so far so good.
Yeah. Um,
Yeah,
I mean, thank you so much for taking the time. I can't even imagine what it must feel like right now because you're planning the burial. Where have you
yeah.
guys reached with the burial plans?
Um, the burial is set for tomorrow because we're only given limited time due to the case. So today we just have to take the casket to the morgue so that we can start off early tomorrow at around 4:30 a.m. and then travel all the way to Kisumu County. Then we also have to return the same day.
Could you tell us what happened? I know we've spoken about this, and I just thought that it's your story. The story of your mom is something that people need to hear, so that they can know
Okay.
the situation. And I'm grateful that you felt comfortable enough to share with us the story. So maybe can we start from what really happened? Like when did this thing begin for you guys?
Um, it's something that started off like 2 weeks ago. My mom started feeling unwell and feeling a bit tired, some aches in the body. So she decided went to a local clinic around. She was treated for pneumonia. She was given some antibiotics and some painkillers. It's until I remember on Friday, she was still going to work. She wasn't feeling well. Um, and then she said, like, let's give some time, the medicine to work. It was until Saturday, I remember, early in the morning, I was given a call by my dad informing me that my mom is unwell. So the next step which we took, I informed my dad if he could be able to rush her to the nearest hospital because we couldn't just be able to assume anything. So I had to rush from where I was staying, from Rongai all the way, and we ended up meeting at the hospital, which was Neema, Uhai, along Thika Road. So once um, she arrived, my dad arrived with her at the hospital. She was immediately taken in, diagnosed, and then the doctors there decided to put her on oxygen. So once I arrived, I found her on oxygen, but she wasn't being treated per se. She was only on oxygen. So we ended up inquiring with the doctors what next, because they advised that she had to be admitted at a hospital. But now they said that they couldn't admit her because the hospital only focused on pediatrics and maternal care. So we were a bit concerned with how come they couldn't be able to admit her because her situation and her condition was quite dire at that particular time. So the only best thing they told us and advised us is that they could only refer her to another hospital whereby she needed actually immediate admission. So one of the doctors there tried contacting other hospitals. I also tried the same. We spent so much time trying to talk to hospitals. We talked to over 10 hospitals, but the report that we were getting is that based on her symptoms, they couldn't be able to admit her. Some other private, we also opted now to go to the private hospital to look for private hospitals. Some of them were giving us some crazy figures in terms of the admission fee, which we needed to pay upfront. One of them quoted 200,000. Some of them even said up to 500,000 based on the current scenario which we were facing. So at that particular time, it was a confusing state for us. We didn't know what to do. So I resulted in calling the toll-free line number for the government for COVID cases. I called, I spoke to a lady. Um, she assisted in a way, and told us that she would be able to dispatch an ambulance because my mom at that particular time, she couldn't be removed from oxygen at that time. And the doctor couldn't allow us to take her in my own personal vehicle to another hospital. So the lady that I spoke to for Nairobi County, and I think under the Ministry of Health, she advised that she'll be able to dispatch an ambulance. This was around 11 in the morning. So we said it's okay. She explained that the situation is quite overwhelming also on their end. And the ambulance would take maybe, let's say, like an hour and a half. So we said, let's just wait for the ambulance so that we could see whether we could be able to rush her to Kenyatta or even Bagati. But apparently, the hours turned into so many hours. We waited to a point. The directors of Neema Uhai also came in. We had a chat with them. They tried assisting in terms of getting us, getting my mom admitted into another hospital. I made several calls also to Kenyatta University. I particularly made calls to actually most of the hospitals, and the information that we were getting is that has the patient been tested for COVID? So we were wondering, this is a patient who's actually suffering. She hasn't been tested, and we were thinking maybe, let's say, she could be tested, and then if the results were positive, then we could be able to know how to treat the case. But now she was being isolated. No treatment, no care was given to her. She was just on oxygen. So some of the questions even I raised also with the directors of NEMA was why couldn't they have like a special isolation room? She could be taken, at least treated based on her symptoms. But they said, they never gave me any concrete answer. So we ended up waiting. It took us like almost the entire day. We were there on a Saturday, remember. It was until around 5:30 in the evening. I even tried calling the toll-free number. It wasn't even going through, just to find out where the ambulance was. And some of the patients, some of the staff at NEMA actually told me that we can actually even wait for 2 or 3 days for an ambulance even to come. So at that time, we had to really make a decision. We spoke to the doctor in charge there, and we asked him whether we could be able to take our mom as a walk-in patient to any of the hospitals. So he said he could be able to do that, but he would advise us to take an ambulance, of which they couldn't be able to even avail their own ambulance. They said if it was taking a patient to Kenyatta, there are those, restrictions, complications. So there weren't much of any help. So we decided just to take my mom in my own personal car, of which we did. It was around 5:45 going to 6. So we rushed her to Kenyatta through the emergency and casualty ward. She was taken, but at least the response at Kenyatta was really fast. She was taken. One of the doctors actually diagnosed her, put her straight into oxygen, and actually told us just to wait because they were a bit overwhelmed also on their end. It took actually until we arrived Kenyatta at around 6:15 p.m. The admission was actually completed at 4:30 a.m. And by that time the doctor was actually telling us that he was trying to look for space in one of the ICUs so that she could be able to be treated. She was only placed in an isolation room with only oxygen. And some of the doctors actually tried to give us some medicine, of which we tried to inquire what was happening. So they told us that they were treating her based on the symptoms she was presenting at that particular time. So we ended up leaving the hospital at around 4:30 a.m. That's the time that she was admitted, advised to come the following day, which was on a Sunday. So I remember on Sunday, I met up with my dad at the hospital. The processes were quite tedious. We couldn't be able to see my mom because we actually had to wait for the visiting hours, and they were really strict with all the protocols which have to be observed because of this pandemic, that only one patient was allowed to visit, only one family member was allowed to visit the patient. So we ended up consulting with my dad, and we decided that he can be able to go and see my mom. So my mom was actually transferred to a ward, not an ICU. She was placed in a ward. There were actually 3 patients in that ward. She was still under oxygen, but the time my dad reached there, he actually saw that my mom was struggling in terms of keeping up to par, catching her breath. It's until he signaled one of the nurses who came, and apparently the oxygen, like, it wasn't working. So we were wondering, like, how long has it not been functioning, the oxygen at the hospital? So that's the time the nurse came, fixed it, and my mom now started getting now the supply of oxygen. So my dad ended up staying with my mom, trying to get answers from the doctors, but it was quite tedious. No one actually wanted to communicate us with what was happening. They told us that they had to take a COVID test, of which they took on a Sunday. So by the time my dad was leaving the room, my mom, at least, we had given her some fruits. We told her to eat something. I spoke with her on phone. At least she regained her strength. This was on a Sunday. She regained her strength. I remember when we left in the evening, we talked to her. We shared some giggles until late, wee hours in the morning. So actually around 11 there, we spoke to her. I remember I told her that I'll be coming the following day with my dad so that we can be able to check on the progress, see what else we can do. So she also confirmed that the doctors came in, took the COVID test, and now we have to wait. So I remember it was on Monday morning. My dad called me at around 6:30, told me that he had arrived at the hospital. He had arrived with some personal effects for my mom. She actually asked for. He carried some porridge just to see whether she could be able to take something. But at that time, he was denied access. He couldn't be able to even go to the ward. So I also myself rushed, though I had to go to town first, and I communicated with my dad and told him that I'll be able to come during the visitation hours, which was from around 10. So my dad stayed at the parking lot waiting. He was denied access until around 9:45 a.m. in the morning, whereby he was now allowed to enter into the ward. He went straight. Apparently, once he reached the ward, he couldn't be able to see my mom. So he went straight to the nurse desk, trying to find out where my mom was. So the nurse there referred my dad, actually told my dad to wait for the doctor. And one of the doctors came, and that's the time that they broke the news to my dad that my mom passed away. They informed my dad that she passed at around 6:45 a.m. in the morning. They tried resuscitating her. They actually transferred her to the ICU at that time, and did all they could to save her life, but apparently now she passed. So it was really a confusion. I remember that time my dad called me immediately. I was having a meeting with another friend of mine. I just froze, rushed straight to the hospital. Reaching there now, it was what it was. Trying to get information, it wasn't helping. They couldn't be able to even assist us so much. So there was a lot of confusion based on the same. They told us we couldn't be able to see her because she was a COVID suspect. And it was really traumatizing for us as family members at that particular time.
So up until this time, your mother now has been confirmed dead, and you still didn't have results, the test results for coronavirus.
No, we didn't. This was on Monday. We didn't get the results. So what the hospital advised us is that they were suspecting it was COVID, but until the official results come, that's the time that we could be able to confirm the same. So the hospital told us that there wasn't any point or reason for us to be able to stay there or wait for the results, but they would be able to give us a call so that we could be able to know. So I remember this was on a Monday. We waited for the call because we were told mostly it takes like 24 hours. We returned back to Kenyatta the following day on a Tuesday. And it was during this particular time my dad went ahead to the ward again, just trying to see whether the results had come out. And apparently, when he was there, one of the nurses received a call. I believe it was from the laboratories where the tests were actually being conducted. And the nurses actually mentioned and said among the two samples, that was for my mom, who's Stella Wanja, and there was another patient called Wanjiru. Wanjiru is the one who tested positive. So apparently, my mom was negative at that time. But the nurse couldn't be able to confirm that. She said until the official communication comes. So we had to wait. She told us that there's no need for us staying there. We just need to go home, relax, and wait for the results. This was on a Tuesday. So we went. We couldn't be able to do anything. We weren't allowed to see her. Waited. Wednesday, we still waited. It reached Thursday. We're still waiting. We actually had to make some few phone calls, try and see whether we could be able to get connections to find out what was really happening. I remember we stayed, waited also on Thursday. It went Friday. So we were really wondering how come the results are really taking so much time. I remember I had to make some few phone calls. I talked to another friend of mine who works there, and he's actually working at the morgue. He actually told me that my mom's body was actually transferred to the morgue. He confirmed, of which that was a sign of relief for us. And he tried to see the file for my mom to see whether the results were there. But apparently he couldn't be able to find any results. So he went ahead, tried to make some inquiry, called, I believe, the laboratories where the tests were being taken. And this is now where the shocker came, that the samples couldn't be traced. So apparently it was a shocker to us because I was just trying to imagine if I didn't make that effort to talk to a friend talked to a friend, we could still be waiting. And we actually waited. So my friend advised me that he could be able to take another sample, now for my mom. This was on Saturday, so that he could be able to now himself oversee now those results. He took a swab from my mom, and then he submitted the samples, I believe, to the laboratory. And we waited again. We were able to get the results on Monday. This last Monday, whereby we received a phone call telling us that the results came positive, and we had to go to the hospital. So we went there yesterday. Once we arrived, told, we're just given some maybe instructions. You need to go to this room, go and see this one, fill this form. There wasn't even anyone who could be able to sit us down, tell us, basically give us the nitty-gritties in terms of the details of what really transpired. If it's a positive test, what are we supposed to do? What are the protocols which are supposed to be taken? The only thing that they told us is that you have until Thursday to take the body. So we actually had to follow in tune with what they were telling us. So it was quite tedious, from the morgue to the ward, the morgue to the morgue, left, right, center, filling a lot of documents. We spent there quite like an entirety of a day. It took us like 4 hours at Kenyatta just to see whether we could be able to get even the burial permit, because they told us that the body has to be taken, it has to be buried immediately.
And you got the permit yesterday?
Yeah, we got the permit yesterday. So today we have to go back, pay an extra 2,000 so that they could be able to release the body early morning, because my mom is being buried in Kisumu County. So we have to travel because of the restrictions, and with the results that my mama received, the protocol is that we have to travel the same day, bury, take the shortest period of time possible, and then travel back to Nairobi the same day. And then, as family members have said, like, just take necessary precautions, we can now enter into our own self-isolation, whereby, as per the protocols which the government has stipulated, that if anything comes up, we can also be able to call the nearest medical facility.
Yeah.
Yeah.
Well, I'm so sorry. Like, it's a very heartbreaking story, and I can't even imagine like going through an experience like that. How do you feel? Have you taken time to just think about, your mom? Was she talking to you while she was in hospital? Like, were you texting?
Yeah, we talked a lot. We talked because you see now they restricted us. We couldn't be able to see her, so the only mode of communication was through phone, texting. She was vibrant. You see now what's really puzzling us as a family, especially even myself, is that the day before she passed, she was really vibrant. She could tell us, oh, tomorrow come, then bring for me this, or talk to your sister. Don't worry, pray for me. Everything will be okay. She was really positive. So when we were told that she passed, the first thing which clicked in my mind is that on Sunday when my dad arrived, the oxygen wasn't working. So would it have been negligence from the staff that maybe, I don't know if they were rationing the oxygen supply? I don't know. I really don't know because they never gave us a concrete answer in terms of what really transpired. And personally, we also felt that, you see, if she had been given that extra care and attention from the point we reached Nemahu High, being treated, being given that care, I believe she would have still been with us because it was really tedious. Calling a hospital and really frustrating. Calling a hospital, them telling you that they can't admit us unless we have a COVID test, or calling this place, giving us some out of, I don't know, crazy figures that we have to come up with like 200 or 300,000 so that we can be able to admit her. It's like people are just trying to take advantage of the whole scenario that we are facing us as a whole nation. And like, even I remember yesterday when I was interacting with some few patients, some of them like had the same scenario like ours. They brought their loved one to the hospital and then only to receive a call the following day that their patient has passed. And it brings out that doubt in the whole system that our patients, let's say like those who are possessing maybe symptoms, which might not be, let's say like COVID per se, how come they're not getting the extra care or they're not getting the treatment that they're supposed to be getting?
Yeah.
And what's really also frustrating is that hospitals now are really being biased in terms of the people that they can be able to admit. As long as you don't have the COVID symptoms, you can be admitted easily. But once you possess these COVID symptoms, they just close the door and shut it to you on your face.
Why did you decide to share this story with us? Because I know it's been a difficult one for many families to talk about, because of the stigma. Why did you feel like it's important to talk about this?
You see the same scenario that we underwent as a family. I believe it's not only us. So many people out there are experiencing the same thing. And it's until it's voiced out that people can be able to maybe take some action, people can be able to review the protocols that are set. And so many people are dying. So many people are dying, not getting that treatment that they deserve. More so, especially during this corona period. Someone can be able to contract. Maybe let's say like I might have a flu, might have some body aches. By default, I have to go to seek consultation from a medical expert, going to the nearest hospital. Now, the problem is that I can't get that care from a hospital. You have to be put in an isolation room. Even when it comes even to the testing itself, it's not that concrete. Today, they're telling you it's negative, and then after a few days, when the test is taken, it's positive. So there's that whole uncertainty of which it really needs to be brought out. It really needs to be addressed. People need to like really investigate and like come to the conclusion of what's really happening. Because we might end up losing a lot of lives, people dying without any concrete reason or without any care being given to them.
Yeah. Well, I mean, thank you so much for sharing your story, and I hope it's gonna, make the health officials, the Ministry of Health, to think about how they're treating people. But maybe just one last one before I let you go, because I know you have a busy day ahead planning the burial tomorrow.
Yeah.
We've been hearing about people who've passed on just as numbers, and I want to know from you, like, how, like, this is your mother, you've lost your mom,
Mhm.
tell us about her. I'm sure she's not just a statistic to you. How do you remember her? How do you remember her?
Um, my mom was someone who was really close to us as a family, and she really meant a lot to us, especially myself. Whereby we had this tight connection. She could basically call me each and every single day. I remember, like, just trying to find out how I am, how I've been doing, whether my family is okay, and then giving me an update in terms of how she's faring on, an update in terms of my dad, how he's also doing, my sisters, how they're also doing when it comes to issues. She could be able to step in. So the connection was really strong. And during this particular time, just coming into that, um, just trying to understand how all this transpired, it's really overwhelming to me myself. I can't be able to understand how we were just talking the other day. We're just sharing good times. We were making plans for things that we're supposed to do. She really wanted also to see her grandchildren. My son told me, like, can you organize I need to see my grandchild. So we planned and said, okay, so you come from hospital, we can be able to organize all that. We had a lot. So having received the results only to indicate that she was COVID positive, it was really overwhelming for us. It was really devastating. And the most frustrating thing is that, you see, like, there's a time she was taking the result, the sample was taken. If we never acted, the sample got lost. We didn't know, so we had to intervene. It was just total confusion. And the way that nowadays people are just dealing with statistics, they're saying, like, today we've lost 40 people, or like 3 people, 2 people. These are people who really mean a lot to their family. These are people who are dear ones and loved ones. The same effort that the government is trying to see how they can be able to contain should be really narrowed down, and especially even to the grassroots. The people who can be able to afford, let's say, going to a private hospital. Not so many people can be able to raise even the 200,000 or the 400,000. Such attention should also be given to them. But the most important is that there should be equality, not that stigmatization for every one of us to just fall under that stigmatization. This such and such person has symptoms of corona, they shouldn't be get treated, or they should be placed in isolation. The same person needs that care. The same person needs that concern, and they need, actually, the government needs just to mobilize each and every health facility, whether it's private, public, the small ones. We all can be able to contribute and be able to see how we can be able to give first aid care to the people even who are showing the same symptoms towards it. Yeah.
Thank you. Thanks for sharing your story, and pole sana to you and the family. Yeah,
Okay.
please pass my condolences to your dad, to your
Okay.
siblings, and to you as well. And thank you so much for sharing your story, for being strong enough to talk about it even at this time. And I
Yeah.
do hope that it's gonna, perhaps maybe save someone else's life.
True.
And all the best with the burial tomorrow.
Mm.
Yeah. Yeah.